So our first speaker is Dr. Richard Jackson. He's the chair of Environmental Health Sciences, and he'll be kind of giving us the framework and laying out some of the issues around public health and cycling.
Good afternoon, and I am thrilled to see you all here. The DVD set that I shared with Vice Chancellor Pawazek was this Designing Healthy Communities one. It's shown around the country in about 5 million homes at this point. And the other is the textbook I use in my course on making healthy places. It's more academic. I don't know if you recall, but in October, the General Motors came out and told us in the Daily Bruin, and in fact, many of the other major university newspapers around the country, that reality sucks. And, you know, General Motors ought to know because it had a lot to do with it. I love this picture of the pretty girl smirking at the guy on the bike, and underneath, General Motors tells us to stop pedaling, start driving, and if you really want to be happy in your life, spend $32,000 on a GM Sierra and spend the next 7 years paying it off with your college loans at the same time. So, by the way, someone said, no, Dick, you've misinterpreted. She is actually flirting with him and wants to get away from the chubby guy that's driving the car. GM has had a long history of being contemptuous of people that use public transportation who walk or bike. This is their ad from about 20 years ago, and what they think public transportation will bring to us, and you'll be really happy if you have a $12,000 Cavalier. Driving is not good for us. Maybe on a country road when it's not crowded and the road is dry and you're not stressed, it's fine. But your adrenaline goes up when you're driving. Your cortisol levels go up when you're driving. Your risk of having high blood pressure, a stroke, and a heart attack goes up during and after the period of driving. And for many people in Los Angeles, is this or this not true? The drive to work, the drive to school is harder than the time you actually spend when you get here. We all know that safety is important, and people say, well, I don't bike because of safety. Rachel Cushing, one day I saw her trying to get across Wilshire on Westwood, and I felt guilty that I was encouraging bicycling because it is very scary. But as a pediatrician, we focus very much on injury prevention. From age 3 to 34, the leading cause of death for Americans is car crashes, injury deaths. And when you count up the years of life lost, when you die at age 4, you've got a lot more years of life lost than if you die at age 84. This is the second leading cause of years of life lost for Americans. Cancer is number 1. So anything we can do to make injury rates go down is a good thing. Well, here's something we can do, and it's been done in a bunch of European cities already. 20 is plenty. So in Bath, England, and Hoboken, New Jersey, they are pushing very hard to reduce the car speeds in dense urban areas to 20 miles an hour. If you get hit as a pedestrian at 20 miles an hour, your risk of dying is unacceptable. It's 5%. But that's a lot better than if you're hit by a vehicle going 30 miles an hour. Your risk of dying is 45%. Now, think about the vehicles that enter the UCLA campus. Which one of them needed to go 30 miles an hour or faster? And I imagine a couple of the emergency vehicles, the ambulances going in. But I guarantee you the taxi cab I saw driving up Westwood, tailgating a couple of young people on bicycles and honking his horn, telling them to move out of his way. I saw this yesterday morning. He was going a good 25 miles an hour. He was not obeying 20 is plenty. And underneath this is the fundamental paradigm, which is somehow in the last 100 years, we decided that somebody in a car was inherently more valuable than someone who was on a bike not polluting and getting exercise, or someone who was walking and not causing congestion. Look, vehicles make air bad, and clean air is important. The worst polluted places in the United States at this point are hot places up against mountains that have huge amounts of vehicular traffic, and that is mainly Southern California. And Colleen Callahan has done wonderful work with the Lung Association on just this issue of how we move to decrease polluted air in California. There are a couple of really important ways. One is AB 32 and SB 375. If you do compact development, people don't need to be in cars so much. air pollution, ozone, and greenhouse gas emissions go down. Kids that go to school in air polluted areas, back during the peak of the air pollution period, late 60s, early 70s, Beata Ritz, one of my colleagues, did a study of that population. Babies born out up against the mountains were 7 ounces smaller than the babies born close to the ocean. That's a 200-gram decrease in a birth weight means that a lot of impediment to growth has gone on, including mental growth during that time. Rob McConnell did a study looking at 6 schools where kids that you would be very proud of went off and became athletes at those schools. They were in high air pollution areas, and 6 schools in low air pollution areas at the end of 5 years went back, and the kids in high air pollution areas had 3.3 times the rate of asthma. So anything you can do to get people out of their cars, get them to drive less, is saving lives, making healthier babies, making healthier athletes and young people. Not only is safety important, not only is air quality important, our body mass index is important. Here's the body mass index of the United States, on average related to 200,000 telephone interviews a year done by the CDC or paid for by the CDC. Here's obesity rates in 1991. California was about 10 to 14% obese in 1991. What do you think happened the next 5 years? 1997, we're up to 15 to 19%. Indiana's over 20%. By the year 2004, a brand new color, over 1/4 of the population in Texas is obese. And in 2009, a brand new color again that stippled is over 30% of the people in Oklahoma, for example, are obese. By the way, the healthiest city and the healthiest state is Boulder, Colorado. And if any of you have been in Boulder, Colorado, the Olmsteads convinced them to put bicycle routes along the creeks and rivers coming off the Flatirons. And then about 30 years ago, they put north-south roads in place. And you pretty much can go about your life in Boulder, Colorado without getting in a car and bicycling most of the places you want to go. We've added 25 pounds to the weight of an average adult in the United States. We've added 14 pounds to the average 14-year-old girl in the United States in 1 generation. Tripling in teenagers and a quadrupling in the rate of obesity. At this point, 2 out of every 7 young people that volunteer for the United States military cannot get in because of obesity and lack of fitness. Being obese is bad for us. It raises our risk of having high blood pressure, of having a stroke, of having heart disease, of having gallbladder disease, of having liver disease, bad joints, a baby with a birth defect, and 1/3 of our abdominal cancers are related to obesity. But this is the one that really scares us from an economic standpoint. The university down there with one bike rack, the medical center, will tell you that the finest place around, they cannot handle the avalanche of diabetes that's coming at us as a society, I guarantee you. The lower line is the risk of becoming diabetic if you're a man as your body mass index goes up. You can see that if you hit morbid obesity, you're about 40 times as likely to become diabetic. If you're a woman, you are 90 times as likely to becoming diabetic. Obesity is a matter of life or death, and damn it, diabetes is really a matter of life or death. Here's diabetes in 1994, California at about 4% of its population being diabetic. In 2001, 6 to 7%. In 2007, California is up to about 6%. When I interviewed to be state health officer in Governor Schwarzenegger's office, I did this in 2004 when I left CDC after 10 years as essentially the highest health and environment person in the country. I was asked what my priorities were, and I said 1 is terrorism preparedness, and the 3rd is the infrastructure of public health. But number 2 is obesity. This will crush our healthcare system in the United States. Being diabetic raises your risk of losing your eyes, losing your kidneys, and losing your feet. When I was a young doc, the 5th reason people needed to have kidney transplants was diabetes. It's now far and away the number 1 reason people need kidney transplants. When I went to the pediatric diabetes clinic, it was all juvenile diabetics, insulin dependent. It's now more than half of the children in the diabetes clinic have type 2 adult onset diabetes, and we're seeing 15-year-olds with diseases that we used to see in 50 and 60 and 70-year-olds, basically weight related. So, we got good doctors, so we'll fix this. By the year 2050, 1/5 of all the people in the United States will have diabetes. And if everyone gets really good treatment, 1/3 of the population will have diabetes. There is no treatment that works for type 2 diabetes as well as physical activity. And when you take physical activity out of people's lives, you are stealing their health. So General Motors is right. We've seen a 4-fold increase in antidepressant consumption by people in the prime of life. And thanks to General Motors, in many ways, the way we've built America, reality sucks. So fitness is important. We've got to do things to make our population more fit. Tom Torlakson, a wonderful guy, good friend, is now the Secretary of Education for the state. He was behind the fitnessgram on the report card. This is really important. It ought to be on the report card. Not the BMI necessarily, Jack, but the fitnessgram ought to be on the report card. Only 1/4 of our kids can pass the fitnessgram. Can you run, walk a 12-minute mile? Fitness really matters. Your risk of developing high blood pressure goes down the more fit you become. The risk of dying of a digestive cancer goes down the more fit you become. The risk of dying of breast cancer goes down the more fit you become. The risk of dying goes down the more fit you become, age adjusted. And the risk of becoming demented goes down the more fit you become. So when we steal fitness from people, or the opportunities for fitness, we are undermining their ability to be healthy. And I don't accept that fitness only happens in the gym and on a treadmill. It happens in the incidental exercise that we need to build into our daily lives. If a man goes from low fitness to moderate fitness, he adds 6 years to life. That's almost as good as stopping smoking. That's remarkable. If you go from low fitness to high fitness, almost 9 years of life. So we got rid of cigarettes on the campus. Well, we ought to be embracing fitness on the campus. I don't for the life of me understand why we would spend billions of dollars on freeway widening and not put a proper bicycle route, or at least accessible way for our many young people who live in Santa Monica to get to this fine campus. It's scary as can be to get from Wilshire. I was meeting with the pediatric residents last week, and a couple of them said, I'm on call a lot of times at night, and I have to come over to campus. I live in Santa Monica. I have to come over to campus between about 5:30 and 6. And she said, I always bicycle because I can get there 3 times as fast as I can in my car, and yet I'm scared to death as I have to go under the freeway on Wilshire. So a lot of our faculty, including 2 of our department chairs in the School of Public Health, live in Culver City. And I thought, gee, I wonder if I go to Google Maps, how far that is and how long it takes. And I tried to do the green bicycle routes, and it's 5.7 miles from downtown Culver City to the campus. 38 minutes is what Google said it would be. That's about how many calories one way? About 400 calories. Do that 4 days a week. 8 round trips is 3,200 calories. How many calories in a pound of body fat? It's about 3,500. So every week, if you did this, you'd burn off a pound of body fat. So the course over 3 10-week quarters, you've basically burned off the excess 25 pounds that our sedentary, over high fructose, corn-sugared lives that we live in America has given to us. So we need to, of course, respect the bay and the ocean, and not and we ought to be put these decals and stencils on our streets and sewers. But I think we need to get a new set of stencils. And just as we put bikes, we should be putting these all over the campus as well. Jack, they wouldn't be that expensive. And so let me stop there. Thank you for your attention.